Hello there. We are now doing the lecture on guinea pigs, listing methods of clinical assessments, listing common health conditions, identifying common parasites, identifying potential zoonosis, specifying reproductive, anatomical, biological, and treatment nuances, and explaining enrichment as it pertains to the species. Again, you've got your fill in the blank, and here we go. So I'm starting you off just with how we house them at the Primate Center. We'll talk about some nuances and specifics, but this is the piggies that we'd had last year and our housing. Why would somebody want to use guinea pigs for research? They are a relatively small size, very docile animals. They have an immune system similar to ours, and that means that they respond to infectious diseases the same way that we do, as well as allergic responses. Of all of the animals we could use, their anaphylactic shock response is most similar to humans. Their ear structure and their ear function is nearly identical to ours, and like us, and like zebrafish, they have the same vitamin C requirement. Things that we can use them for, again, because of that vitamin C requirement, we can use them for hypovitaminosis research, delayed hypersensitivity reactions, things involving the lungs, such as asthma, tuberculosis, also auditory research, pregnancy toxemia. They are a very useful little model. Believe it or not, there's some common breeds of guinea pigs. I don't know if you knew this, go into the pet store. The scientific name of the guinea pig is Cavia procellus. They are rodents, but they belong to the cavid family as opposed to the murid family, so they aren't in the same branch as the mice, rats, hamsters, and gerbils. They're in a different category. Just like with the mice, there are inbred and outbred strains, so we have animals that are more closely related genetically and others that are a little bit more removed genetically. The most common outbred are the Duncan Hartley, which I always remember like Dunkin' Donuts, or the Hartley. They're both albino mutations of the English breeds. And then for your inbred, there's the very thoughtfully named strain 2 and also strain 13, which is a tricolor. And then there's the IAF hairless. That animal has no coat. You might have seen Lidwig on Instagram ages ago. These animals are actually normal physiologically wise and immunologically wise. So unlike the nude mice, these animals have a functional immune system. Biological data, really fun. We see premolars here, but still no canines. And why don't we have canines? Because they are not carnivores. So just like the other rodents we have talked about, their incisors are hyposodonic, but so too are their premolars and their molars. So every tooth in their mouth has the potential to have malocclusion. Their digits are interesting. They have 4 on the front, 3 on the back. More biological data. And some of this varies depending on the strain. So some animals are a little bit smaller than others, but in general, you're going to have animals weight at maturity between 700 and 1100 grams. They can live 4 to 6 years. Their body temperature is still in that 99 to 100 plus range. 103 is about the highest. Heart rate 200 to 400 beats per minute, and their respiratory rate is 45 to 100 breaths per minute. These are animals that drink a lot of water. So 3 times the amount of a standard rodent, 10 to 15 mils per 100 grams of body weight a day. They also eat quite a bit, 6 grams per 100 grams of body weight a day, and require vitamin C. They put out a lot of urine, 3.5 to 4.5 mils per 100 grams of body weight a day. When it comes to terms, it's nice because if you've ever worked with swine or have learned things about swine, the language is similar. Males are boars, females are sows, and the offspring are pups. They hit sexual maturity at about 3 months. Very important, they need to have that first litter born before the animal is 6 or 7 months of age. Otherwise, the pubic symphysis will fuse and the animal will have dystocia and could possibly die. They hit their first estrous cycle, or sorry, their estrous cycle is about 16 days. Interestingly, they have a perforate vaginal membrane, so they have an actual membrane over the vagina that opens just prior to estrus and it closes after ovulation. They are the only animal that we will study this term that has that. They have a bicornate uterus, just like the other rodents. Their gestation, longer than your other rodents, 59 to 72 days, and they have anywhere from 2 to 5 in the litter. I did have a guinea pig have 13. It was horrifying. Neonates weigh about 60 to 115 grams, and these animals are precocious. That means that they are fully furred, toothed, and ready to run around the cage as soon as they dry off. Also, interestingly, like rabbits, they do not nurse for the first 24 hours. So if mama has to have a C-section or something, you've got some time before they need to be nursing. They get weaned after 14 to 21 days, so just because they're born with teeth and they do eat solid food shortly after birth doesn't mean that they don't have to stay with mama. They still need that milk, they still need the colostrum. So again, unlike most rodents who give birth to blind, helpless little animals, guinea pigs are born precocious. And they will run around the cage, so don't think that you have time to prep your nursery cage after they've been born. No, you need to do that before. Sexing is interesting. The males have a penis that's retracted and you can actually push out. They have prominent lateral scrotal pouches. Those testes don't descend at birth, it's a little bit later. And unlike many of the other rodents, they actually have a pair of nipples and they're in the inguinal region. So right up in that inguinal space. Those nipples are less prominent than the female. So there could be a true or false question. True or false, do male guinea pigs have nipples? You will now know the answer. Your female, they have separate urethral, vaginal, and anal orifices. They have an intact vaginal closure membrane, that perforate membrane. They have a Y-shaped depression in the perineal region and a single pair of inguinal nipples. So I wanted to show you how to sex. I'm hoping that the sound is off on this. I want you to notice that it takes a little bit of work to get the animal into the right spot so that you can protrude that penis. You'll want to see if this animal is male or female and see if you can see the inguinal nipples at the very start of the video. There's the little penis, so this would be a male. And you can see the inguinal, well, right as the vet turned around, you could see the inguinal nipples. Can't say this enough, nipples for all. Okay, husbandry. Husbandry can be really interesting with these little guys. They are USDA regulated animals. So they are being held to the Animal Welfare Act standards. We also use the guide. They are going to be housed at the same temperature as your rats and mice. That's 68 to 79 degrees. Humidity is the same as the rats and mice. Air exchanges are the same. They do need a bit more space than rats and mice do. And of course, we're going to be providing them enrichment because that is required. Housing can take place in a few different setups. We like rectangular shaped caging because it keeps them from stampeding and getting hurt. It turns out that guinea pigs don't like being in open-topped containers. This is a aversive housing setup for them. We didn't know this at the time, and I actually did a research study on it. We thought that this would be preferable for them because it's open and airy and that would be nice. And instead, the animals would hide underneath their hut all day, every day, coming out only to eat or drink and then going right back to this hut. We ended up converting their rack into the one that I showed you at the start, where they're in a rack like this with bedding. And we looked at their behaviors before and after using a baby cam so that we didn't have to go into the room. And we found out that when they were in the tubs, they spent 87% of their time hiding in the huts together. But when we moved them into the racks, we only saw one instance where the animals were all in the hut at the same time. We had to stop our assessments once we moved them into the rack because we saw a 500% increase in species normative behaviors. They went from hiding all of the time, which was here in the tub, to hiding a little, walking around a lot, playing a lot, eating a lot. So much, much more observed behaviors. Enrichment that's meaningful for guinea pigs is social interaction. Honestly, that is one of the most important things that you can do for a guinea pig. They need companionship. They also like to burrow, they like to gnaw, they are foragers, and they like to seek shelter. Burrowing can happen in things like loose hay or any sort of hut, pipe, tunnel type configuration. Good hearing. Vocalization is their primary means of communication. And if you want to go to this Wikipedia link, you will be able to hear all of the sounds that they make. They have short legs, stocky bodies. They don't climb or jump well, but they do hop, and their hopping is called popcorning, and they do that when excited. One thing about the study that we did when we had them in the tubs, we never saw them popcorn. When we put them in the racks, they started popcorning right away, and my staff was absolutely blown away. We did not think we would see that much of a behavior shift. Guinea pigs are easily startled, so if you have them in clinic, be very careful when you're going into their crates because they can actually have a panic reaction that can cause them to hurt themselves. They will either freeze or stampede, and if there's more than one in that kennel or if there's babies in there, they can kill the babies. And just like with mice, barbering is common in guinea pigs that are housed together. The dominant animals will chew off hair of subordinates, leaving bare patches which could be confused with a skin problem. Guinea pigs are known for wasting their food. They're known for sitting inside their feed hoppers and peeing and pooping in them. In lab animal industries, we give them J feeders. They're called J feeders because they look like the letter J, and that keeps them from sitting in their feeder and then pooping in it. They also are, we think, very related to swine because they are really bad about playing with their water, just like swine. They will blow partially chewed food into water sipper tubes, clogging the tubes, resulting them in needing to be cleaned. If you have a guinea pig coming into the clinic for dehydration, one thing that you might want to look at is if they've brought their water bottle with the guinea pig, check it to see if there is a blockage because that food can get up in there very easily and not everybody realizes it and they don't always clean it. Nutrition, just like us, they need to have vitamin C provided externally. Only feed guinea pigs guinea pig food. You have clients come in, ask them what they're feeding, ask them to bring a picture of what they're feeding, the actual bag. Make sure that they're not feeding them rabbit chow because it does look the same. Rabbit food does not have vitamin C, only guinea pig food does. And food for guinea pigs has to be used quickly because that vitamin C breaks down pretty fast. The pelleted diets need to be fed within a window of time specified on the package by the manufacturer. Often that is a 90 to 180 day window depending on the product, and if that manufacturer, you can fortify their drinking water with vitamin C, but it has to be prepared daily because it breaks down. And again, do not feed food intended for other species because it will not have the right vitamin requirement. This is what that looks like. Unique physiology. Guinea pigs are kind of cool. Like other rodents, rats, they don't have the physiological mechanism to vomit. So you don't have to do a pre-surgical fast for guinea pigs because they won't be able to vomit anyway. But if you're doing an endotrache intubation, you will actually want to fast them overnight just so that the mouth and larynx and pharynx are clear of food materials. If you don't do that as you're passing that ET tube, you can pick up the food particulates and then introduce those particulates into the trachea and possibly cause bacteria introduction and thus pneumonia. Guinea pigs are very sensitive to antibiotics. We'll talk about this again in the clinical section, but it's worth mentioning also in the unique physiological section. Some antibiotics can cause a toxic shock syndrome, especially if those antibiotics are in the gram-positive spectrum, like a penicillin. The penicillin or gram-positive goes in to the intestine, kills the intestinal flora, and that actually allows an overgrowth of Clostridium, which is normally in their gut flora, in small amounts. When large amounts of Clostridium are produced, it actually produces a toxin that gets released. They may present with diarrhea initially, and then they will die very, very quickly. So clinical concerns for guinea pigs: malocclusion, hypovitaminosis C, bordetella, pododermatitis, enterotoxemia, and pregnancy toxemia. Clinical signs that you should be paying attention to is their activity level. Guinea pigs generally are very active little animals, and if you see that change, there's a problem. Also vocalization. They're very talkative little buggers, so if you see them suddenly not as vocal, that could be a sign of a problem, as can self-trauma. If they've gotten injured, they may start biting that area. Ataxia, if you see them like wobbling, that's a problem. And then of course, looking for cyanosis, pale mucous membranes, respiratory distress, weight loss, dehydration, having lost their body condition, and reduced intake of food and water. Malocclusion is a tricky one in guinea pigs because, again, all of their teeth, including those premolars and molars, are hypsodontic and can and could overgrow. So, all teeth can be affected. Again, Dremel or file the teeth regularly to treat, and do not breed these animals. In this guinea pig, I don't know if you can see, both of the upper incisors and one of the lower incisors are overgrown. Hypovitaminosis C is caused by a lack of vitamin C. They can't produce it naturally. This impacts collagen formation, so they'll get bruising, and it damages their bones, their teeth. They have macrophage and heterophil changes, and they're going to have problems with cholesterol. So true question for you: is rabbit food nutritionally balanced for guinea pigs? Really hoping that you're saying no to me. With hypovitaminosis, things that you might see are possibly malocclusion or teeth that are loose or falling out, anorexia, diarrhea, lameness, pain, alopecia, and then gingival hemorrhaging. That's a classic finding. If you see bruising, bleeding in their mouth, that could very well be scurvy, as this is also called. How do you treat this? Well, vitamin C is going to be a very important element, so making sure that they're actually getting that vitamin C, giving them supportive care, but truly prevention is key. Make sure that they are getting the right foods, make sure that they are getting the right supplements and enrichment. Produce such as fresh kale, parsley, thyme, and mustard greens have lots of vitamin C, so that can be a good food for them. And we have pictures. This is a non-human primate, but you can see the gingival bleeding and bruising. Here you have an animal who has lots of hair loss. This is alopecia. And thinking back to the grimace scale of the mice and the rats, I don't know that there is one for guinea pigs. I should have looked that up earlier, but this animal definitely has squinty eyes and droopy ears. The animal over here is having difficulty getting its limbs underneath them because this does also impact the bone. This poor animal has multiple signs, very thin hair coat, looks like they're struggling to keep their feet under them. That could be the substrate that they're standing on. Can't say for sure, but it's certainly something I would want to pay attention to if I had one come into clinic. Pododermatitis. Ugh, this is a nasty thing. Hopefully you will not see this in clinic, but honestly, I think you probably will. This is a situation where obese animals, which guinea pigs get chunky really fast, are being housed on wire caging. And it causes swelling, it causes thickening of the skin, and it's caused because they have that added weight, which causes the skin breakdown. And then if there's poor sanitation, suddenly they have staph infections and their poor little feet just get overgrown with that staph. You can treat with antibiotics, surgery, foot soaks, DMSO, and bandaging. The prognosis is guarded though. Like once this gets into their system, it's in there, and unless the client is willing to get that weight off and do what it takes to keep the cage sanitized, this may just come back. Enterotoxemia, speaking of a naked guinea pig, this is caused by giving guinea pigs certain antibiotics. So there are some antibiotics they just can't have. When they get it, it causes a clostridial overgrowth, which causes toxins to build up, which makes them very, very sick. You're going to see diarrhea, anorexia, dehydration, hypothermia. Supportive care is what it's going to take to treat, getting them off of the antibiotic that caused the trouble in their intestines, but the prognosis is poor. Once they hit that diarrhea dehydration phase, it can be really hard to turn them around. So what antibiotics should you be avoiding? You should be avoiding your gram-positive bacteria, so any of your mycins or psyllins. Those should be avoided, even your sporin. You can do some penicillin as an injectable, but it is risky. The list of what you can use is a little smaller, so your Baytril, your chloramphenicol, your TMS, tetracycline, tylosin, and again, maybe penicillin injectable, possibly. If you were to use a gram-positive targeting antibiotic, what condition would you develop in that guinea pig? Enterotoxemia. Another type of toxemia is pregnancy toxemia, which is a ketosis. So this is where the animals are metabolizing fat instead of sugar. It's a result of a negative energy balance. So if you've got a female guinea pig coming to your clinic and they are just presenting poorly, check their blood work, see if they are in acidosis, see what their glycemia level is. Treatment: IV fluids, dextrose, oral fluids, oral glucose, but really this has a poor prognosis and it's better to prevent than treat. Preventing obesity, making sure the animals are moving around, and making sure that they have food and water readily available during pregnancy. Those clinical signs: anorexia, depression, ataxia, dyspnea, and it could progress into muscle spasms, paralysis, and of course, unfortunately, death. There's a circulatory form of this as well, and this is similar to what we see in humans with preeclampsia. So the uterus compresses the blood flow. There's problems getting blood to the placenta, the uterus. You can end up with fetal death, fetal decomposition. It can impact the kidneys. It can impact the GI tract. This can be a scary, scary thing. Um, Treatment would be an emergency C-section, supportive care, IV fluids. It's a very high-risk surgery. This is not a good thing for these animals to have. So if you've got a pregnant guinea pig coming into your clinic, just be on your toes. Things could go real bad real quick. Okay, contagious parasites. So Bordetella, kennel cough. This is a fun one. And it's fun because the guinea pigs don't typically have this themselves. They get it by being exposed to carriers, and those carriers are rabbits, dogs, and cats. Clinical signs: anorexia, lethargy, nasal and ocular discharge, trouble breathing, cyanosis, otitis, and this is potentially fatal. You can treat it with antibiotics, with supportive care, with bumping up their vitamin C, but really prevention is way, way, way better. Making sure that the animals are coming from a housing area that doesn't have this in there. Don't house them with rabbits, cats, or dogs, and vaccinate if at all possible. Transmission is aerosol, direct contact, contaminated fomites, or even genital contact. So this is all problematic. Sorry, went through that really quick. Notice that there's nothing in red on this slide, so don't panic if you're like, oh my gosh, I don't remember all the names of the protozoa. You don't need to for my class, but you would possibly want this for boards. So just kind of have it in the back of your mind that they do get protozoas, they do get other types of parasites, just like all the other rodents. Okay. If you have questions, please email me, and we'll see you later. Take care.